Hello everyone, this is Prachi. Welcome to my channel by my dad Prachi. So today we are going to talk on very interesting topic. Topic's name is ventilator machine. In this topic, we will learn what is ventilator, when it is used for patient and how ventilator works. Very first, we should know how our lungs works. I have added a video of lungs physiology. Have a look. In every human being, there are two lungs. Right side lung is divided into three lobes, and left side lung is divided into two lobes. Expansion and contraction of lungs fascinates the inhalation of air inside the body and exhalation of air outside the body. In lungs, oxygen is taken by blood cells via alveoli, and in exchange, carbon dioxide is sent back by blood cells to the alveoli, which is again pushed outside the body by lungs through action called contraction. This whole process is called as breathing or respiration. That's how our lungs takes oxygen from air into the body and exhales carbon dioxide outside the body. In normal human being, breathing happens like this, but sometimes someone may have not normal breathing capacity because of some diseases or defects in lungs functionality. If any infectious organism attacks lungs, then lungs may fail to run the normal expansion and contraction process, or some types of infections may attack the alveoli. In that case, gas exchange process will not take place properly. In such cases, patient body would not get enough oxygen, which would lead the death, because oxygen is the most important factor our body need to run all metabolisms. In such cases, ventilation is used for the patient who cannot breathe themselves. So, ventilator is nothing but the supportive system in cases of breathing system failure. Okay, now we will see how ventilator works. This is ventilator. Ventilator have two ports. One is inhalation port and another is exhalation port. Oxygen is sent to the patient lung through inhalation port and exhaled gas is collected to the exhalation port. Every intensive care patient have different requirements of treatment. According to their medical conditions, doctor or clinical team decides how the ventilator is used to patients. Ventilator have some specialized mode for different breathing patterns and for the fast recovery of patient's breathing system. In ventilator, there are parameters to set the rate according to patient's condition, age and treatment type. Parameters are tidal volume, RR, PEEP, FiO2 and peak pressure. Important modes of ventilator are volume control, pressure control, SIMV and support modes and CPAP. Very first, we will understand the parameters. So, first parameter is tidal volume. Tidal volume is the volume of air inhaled in lungs in one breath. Second is minute volume. It is a volume, total volume of air inhaled in lungs in 1 minute. Third is RR, respiratory rate. It is a rate of inhalation of air in 1 minute, that is, how many times we breathe per minute is our respiratory rate. Relation between all three parameters is minute volume is equal to tidal volume into RR. Next is peak P, that is peak pressure. It is a pressure built in lungs after inhaling oxygen at lungs fullest capacity. That means it is a maximum pressure of lungs after inhalation. Fifth is PEEP. PEEP means positive end expiratory pressure. When lungs exhales the gas out, then some pressure always remains in lungs. That pressure is called as PEEP. PEEP is natural safety term which prevents lungs from collapsing. Sixth is FiO2. It is a percentage of O2 set in air mixture going to the patient. Next is IE ratio. IE ratio refers to a ratio of inspiratory portion compared to the expiratory portion of breathing cycle. Normal IE ratio varies from 1:2 to 1:4. After that, trigger sensitivity. This is very interesting term. The patient on ventilator may have different health conditions. Some patients may be in recovery state, can make efforts to take breath themselves. In such cases, when patient tries to breathe, which in result negative pressure gets created in ventilator breathing circuit, and then ventilator senses that negative pressure and supports to that breathe. Clinical team decides how much should be that negative pressure sensitivity. Normal sensitivity setting should be between -1 to 2 centimeter H2O. These are very essential parameters of ventilator settings. Now we will move towards the ventilator modes. The majorly used modes I have explained in this video are: first is volume control. In this mode, doctor set how much volume of air should go inside the lungs and to be exhaled. In this mode, volume keeps constant and according to patient lung response, pressure keeps changing. This mode gives mandatory continuous breaths to the patient as per set rate. Next is pressure control. In this mode, doctor set how much pressure should maintain inside the patient lungs while inhaling and exhaling. In this mode, pressure is maintained constant and according to lungs response, tidal volume keeps changing, but it should be in normal range. Third is SIMV mode. SIMV means synchronous intermittent mandatory ventilation. With this mode, the ventilator will deliver a mandatory, that is set number of breaths with set volume, while at the same time it allows patients spontaneous breaths. And these spontaneous breaths are delivered when airway pressure drops below the end expiratory pressure, that is trigger. Next is PSV. This is pressure support mode. That is pressure support mode. Pressure support ventilation is a mode of positive pressure mechanical ventilation in which patient triggers every breath and ventilator supports those to attain the ideal volume or pressure. Next is CPAP. CPAP means continuous positive airway pressure. When a patient on CPAP breathes in, the ventilator machine will provide one constant pressure during the inspiration. When the patient then breathes out, the ventilator will continue that inward pressure during the entire expiration. It provides one continuous pressure throughout the respiration cycle. The pressure is set to the same level for inspiration and expiration. You can see in graph. Okay, hope you have understood all these parameters of ventilation and all the modes of ventilation I have explained. Now I will show you how ventilator looks on its display so that you will understand better. So guys, hope you got it better. I hope you liked today's video. Thank you so much for watching till the end. We will continue with new topic next time. Till that, keep learning, do your best. Bye bye.